if your molars cave in this way, that means your side walls of your nose also moves inwards too, because the side walls of your nose follows your upper molars. So everything moves in together as a unit. So that side-to-side distance in your nose is more narrow than normal. So notice what happens. The molars are caved in this way. The side walls of the nose are caved in this way. You have a deviated septum. And you have turbinates that are much more sensitive to swelling due to irritation, allergies, colds, or infections. So that kind of sets you up for nasal congestion. Okay. So this is what happens with small jaws. This is a relatively normal oral cavity picture. This is what you see in the textbooks. So you have the tongue down here, the soft palate up here, the roof of your mouth there, tonsils over here. But notice what happens as the jaws get more narrow, the tongue starts to move up, and then the tongue keeps moving up higher and higher until it moves all the way up here. But notice how, if you look in the shadow behind the tongue, how that side-to-side distance is more narrow. So most people with sleep apnea will have one of these two configurations. And then, as you're probably aware, sleep apnea is associated with numerous other conditions, especially in the head and neck area, including TMJ, muscle headaches, tension, spasms, neck pain, sinus headaches, ear problems. I mean, just almost everything that's in the head and neck, it can be related to sleep apnea. And having all these other conditions can also make the sleep apnea worse, too. So it's just like a vicious cycle. Okay. So, one last thing that wasn't on the slide here, and I may mention it a little bit later, is if that angle between your septum and your nostril is more narrow, what happens is that the nostril can cave in a lot easier too. So if your nose is stuffy on the inside, as you breathe in, your nostrils tend to cave in a lot easier. So then that just makes everything congested in your nose, and that has an effect downstream. So imagine if you pinch your nose and you sucked in through your nose, what happens? You create a vacuum effect downstream, right? And then that causes collapsible things in your throat to collapse even more. So we'll get to that a little bit later. So we talked about nasal function. Now, there's something called the nasal cycle. This is why many of you realize this. Sometimes one side opens up and the other side closes and it goes back and forth. That's called the nasal cycle, and that's normal. But when your nose is a little more stuffy, when there's less room to accommodate for the size differences of the turbinates, you're going to notice it more. Especially if you're laying flat, what happens is, due to gravity, the turbinates, because it's vascular tissue, it just swells up with blood. And then, so now, on top of having narrowed cavities, if the turbinates are swollen, and you have this constant swelling going back and forth, then you're going to notice it more. So then your nostrils cave down more, and then this is this vicious cycle that I talked about. Okay, now, non-allergic rhinitis, this is actually probably more important than allergic rhinitis. So everyone knows what allergic rhinitis is, right? You know, when you have sensitivities to pollen, dust, molds, animals, things like that. But non-allergic rhinitis is, it's a neurologic condition where the nervous system inside your nose is overly sensitive to any kind of stimulation. So the more common stimulants are weather changes, like temperature, pressure, humidity changes, chemicals, scents, odors, perfumes, just pretty much anything out there that you can't test for. Okay.
Does that include like walking from a dark place into the sun?
Yeah.
Sneeze?
Yep. Well, that's actually more of a reflex. That's a different reflex with the retina. So that, I mean, a lot of people have that when you look up in the sky, you sneeze.
What was the question?
Oh, he asked, is that why when you go from a dark place into the sun, you sneeze? And that is due to a reflex in the retina. So many people have this, I've had that happen to me too, where you just look up in the sky and you just have this urge to sneeze. Now, one other thing that can trigger non-allergic rhinitis is CPAP. So if your nose is sensitive to any kind of irritation, imagine putting something on your nose and putting positive air pressure in there. So that's why many people tolerate CPAP well, but some people, it just makes things worse. The nose gets even more stuffy, they get more irritated. So this is one of the reasons why some people just cannot tolerate CPAP, or they need an extended acclimation process so they kind of get used to it. Okay. Now, another condition that you commonly see in people with stuffy noses is sinus headaches. I mean, I'm sure many of you have various degrees of this. In most cases, when you see the ENT doctor, you're going to get treated like for sinusitis, like an infection. So you get antibiotics, decongestants, allergy medications. And typically it'll help, but it keeps coming back. And the reason is that in most cases, it's been shown that these are not infections. So they've done definitive studies showing that if you went to your doctor for a typical sinus infection, pain, pressure, headaches, postnasal drip, and congestion, if we were to do a CAT scan at that moment, 90 to 95% of you would have normal CAT scans, meaning that there's nothing inside your sinuses, just air. And what that means is that it's not really an infection. What you're suffering from is a variation of a migraine attack. So what's your typical classic description of a migraine? Headache? What also happens? What are the associated symptoms of a migraine?
Light sensitivity.
Okay, sensitivity, right, nausea, light sensitivity, dizziness, right, pounding headaches, right?
Sweating.
Right. So that is a nervous system reaction, but that same nervous system reaction can also happen in your sinuses. So if the nerve endings in your sinuses get irritated, then you get, depending on where it's happening, so in the sinuses it's pain, pressure, congestion, headache, postnasal drip. So that's why when you take decongestants, it helps a little bit, but it doesn't cure it completely. And curiously, you can also have a migraine in other parts of your body too. So if you have it in your ears, you can have dizziness, hearing loss, lightheadedness, ringing, balance problems, all those kind of vague, inner ear balance problems that many people also have. Also in the stomach. Think about having a migraine in your stomach. What would happen then? Everything from constipation, diarrhea, bloating, indigestion, right? So these are kind of peripheral concepts that have been proposed. It's interesting how everything can be explained by an explanation that you would normally not expect. Okay. Now, we also know about the sleep apnea headache. That's a very common description of people with sleep apnea. But in most cases, what's been shown is that these are actually sinus headaches, and it's that atypical migraine. Because when you have sleep deprivation, that's when you get migraines. When you get, for example, if you have a hangover, what happens? What's your typical hangover headache? Pounding headaches, light sensitivity, noise sensitivity, pressure, nausea, queasiness. So notice how it's all very similar. Because when you get drunk, what happens is that alcohol relaxes your muscles, and you stop breathing much more often. So you're actually inducing apneas. Okay, so this chronic rhinitis condition, because it's a neurologic condition, it's harder to treat than allergic rhinitis. So if you had the typical spring pollen allergies, that's pretty easy to treat using avoidance measures or allergy medications or allergy shots. But these neurologic conditions, the allergy medicines help somewhat, but it doesn't get rid of it completely. Now, you can use nasal salines, nasal saline irrigation, neti pot. There's various different kinds of different ways of getting salt water into your nose. And for the most part, they help really well. And if you do it on a regular basis, it helps to decongest the mucous membrane, so that's why you feel better. The downside is, I see you have some over there. The downside is that you have to use it on a regular basis to get consistent results. I'll talk about nasal saline a little bit later, the pros and cons of it. Now, there are a couple of other ways of treating this condition. One is Atrovent. This is a cholinergic blocker. So there's a neurochemical that tells the nerve endings in your nose to secrete mucus and swell up. And so this medication actually blocks that process. So it really helps to dry up the nose. So I'll use it sometimes in cases where all these other medications don't work.